Practice makes perfect. We've all heard that before. But for those who work in the medical field, practicing on a human being isn't always a viable or safe option. Meet the new tool they're using at Paul Oliver Memorial Hospital in today's Medwatch. Nurses are dealing with a patient who has a whole host of problems at Paul Oliver Memorial Hospital, but they know he'll be okay. He's just a dummy, or more appropriately, a simulator.
And our goal is to help as many people as possible, but also to make sure that no matter what the situation, if we have the equipment, then the staff will know how to use it.
Laurel Guerra is the coordinator for cardiac pulmonary rehab. She says this new addition is invaluable to the staff here.
It allows them to become familiar with equipment that maybe you use it once a year, maybe you use it once every 3 years. But if you practice how to use something, you use it efficiently and competently every time you touch the equipment.
And because this isn't a major trauma center, an emergency can pull everyone to the floor.
We're a small facility, we're a rural healthcare facility. We have a limited number of staff. And if I called a code blue today in the emergency room, people are assigned from other areas in the hospital to respond. When they respond, they know that what they're supposed to do.
Guerra can program in any kind of health emergency on the sim and call a mock code.
Using a simulator, if you make a mistake, you can start over. In a real person, you can't. And it allows everybody, nurses, aides, maybe a housekeeper responds. Everybody has a role in that code, but simulation allows them to be familiar with what that role is.
Barbara Smith is in charge of orientation for new employees. She says they've had sims before, but this one is much more advanced, more like a real person.
Well, it's not quite the same, but it's very, very close. And I think with the being able to see that the nail beds are turning blue or the patient's breathing, this mannequin can even talk and complain of chest pain, or just as a real patient would.
But more than anything, these experiences can take some of the scary out of what can be a terrifying moment.
What are those things that are going to make your heart stop when they walk into your emergency room? When someone comes in and they can't breathe, they're having a heart attack, they're having a stroke. All those things will make your heart stop when it walks in, and you need to know right now what to do and do it very quickly with minimal staff. So this is going to make us better at practicing all those skills.
For Medwatch, I'm Michelle Dunn.